So these three condition is a very high yield, which is the Legg-Calvé-Perthes, sleep capital femoral epiphysis, and the last one is the Salt and Harris fracture. So what is Legg-Calvé-Perthes? Legg-Calvé-Perthes is you can say is the avascular necrosis of the femoral head. So that means that there is no blood flow, or there is a limited blood flow to the head of the femur. So that is why we said is the avascular necrosis of the femoral head, the head of the femur. Okay, so it's usually for children between the age of 4 to 10 years where you can see it. So there is always a disruption of blood flow. So one of the some of the symptoms you can see is patient may have limping. They will be limping. So always remember, limping child with painful hip. Limping child with a painful hip. So what do we do? So the word limp, they will be limping. And I said there is a vascular necrosis. You can look at it. There is no blood flow. So because there is no blood flow to the head of the femur, the head of the femur, the femur, it will start dying off. That is a vascular necrosis of the femoral head. So in summary, whatever I have said, this is it. The definition: a vascular necrosis of the femoral head, and we also said it's usually children between ages 4 to 10, and that is how to differentiate it with the next condition we'll be talking about. So this is it: a vascular necrosis of the femoral head, and we say that they do X-ray or MRI, and also the the child may have a limp. Okay, so remember another important thing: this leg calf party and sort and Harris fracture and sleep capital femoral epiphysis, they are going to have what we call positive Trendelenburg test. So they are going to have an unequal size of the hip, positive on Trendelenburg test. Then the next condition is the sleep capital femoral epiphysis. So this from the word sleep like something, there is a shift. There is a shift. So sleep capital femoral epiphysis. So what is that telling us? So that there is like a dislocation. There is a shift. There is a fracture through the growth plate, causing the femoral head to slip posterior or inferior. So for this, how to differentiate it with a leg calf party, this is more on between 10 to 16 years. So you can say it's seen more on the younger or the like adult grown up kids. So this leg calf party is more younger people. Okay, let me highlight it again. But in sleep capital femoral is a dislocation of the epiphyseal end of the femur. So you can also say is a fracture through the growth plate. And when it happens, we also know some of other things that can be the cause. So the summary of whatever I'm saying is this, because sometimes I like to represent things in a table for more clarity. So what can be the risk factor? The risk factor can be obesity, the risk factor can be endocrine disorder, but just know that there is a shift, there is a dislocation. Remember, sleep capital femoral epiphysis. So remember that. But then they can also ask you a question now: which is Sultan Harris fracture. So where does this fracture take place? We say that the fracture takes place at the growth plate. Remember, that is when the child is growing. So we want to know what part of the growth plate. What part of the growth plate? So you need to memorize it because it's very, very important. So we have stages 1, 2, 3, 4, 5, and you can use the letters to remember. S. So when it happens straight across, that is type 1. A. When it happens above, when the fracture happens above in the growth plate, that is above, that is type 2. Type 3 is when it happens L, lower, when the fracture happens lower. Then TE is through everything, when the fracture happens through everything. Okay? Then R is crush, when everything is completely crushed. So you just need to know, because they can ask you stage 1 or class 1, where is the fracture? Okay, class 2, where is the fracture? So just know that, and for emphasis purposes, it's the same thing we have said. It can happen straight across, it can happen above, it can happen. So that is your Sultan Harris fracture. So you need to know what class. Is it class 1 or stage 1, type 1? If it happened there, type 1, then that will be straight across. If it happens above, if it happens lower, so that is where the fracture happened. Then the final thing to know is what part of the growth plate, because they can ask what part of the growth plate. So the part of the growth plate now is very important, meaning if it happens at class 1 or stage 1, that means it happens at the part of the growth plate that is affected is what we call, you can use these mnemonics, which is P, PM. I say like P, PM is like morning shift, PE is like evening shift, then PEM is like evening and morning, like a double shift. Okay, then PC is like 24-hour shift. Okay, so that is the summary of what I'm saying. So if it happens straight across, which is class 1, it happened at the physis only, which is what I said P. Okay, then if it happens class 2, what is class 2? Type 2, above, that is between the physis and metaphysis, which you need to call PM. Okay, morning shift, depending on how you want to remember it. Then if it happen in type 3, which is lower, the fracture happened lower, remember where we are coming from, it happens lower, then that will be, when the fracture happens lower, you will see that it happened lower, that will be physis plus epiphysis. So that physis plus epiphysis, you see, you can call it a evening shift, like people that do evening shift. So we can call it PE, evening shift, just to remember. Then we have another class, IV, stage 4, through everything. It happens, people that work double shift, they work physis, epiphysis. So that is your PEM. So these are the fracture happen between the metaphysis, the epiphysis, and the physis. Then the last stage is V, crush. So it's like somebody working 24-hour shift. So it is compression of the physis, everything is damaged. So that is this. It is crushed through. So let me summarize again for emphasis. We started from Legg-Calvé-Perthes. So what is Legg-Calvé-Perthes? Legg-Calvé-Perthes is a vascular necrosis of the femoral head. And what did I mean by that? I say that when there is no blood flow or there is limitation of blood flow, a vascular necrosis of the femoral head. And we say that this child will have a positive Trendelenburg test. Unequal hip, one hip will be smaller or shorter than the other one. So it usually affects the head of the femur, the femoral head. So what happens is that the bone will die. There is fragment revascularization, then modeling over several years. So if the femoral head heals with abnormal shape, it will lead to arthritis in the future. So what are the major risk factor? We said people between 4 to 10 years old. Okay, and it's more common in boys than girls. So the symptom is that they are going to have a positive Trendelenburg test. They are going to have a limping. Okay, and how do we make the diagnosis? We can make the diagnosis using X-ray, MRI, and physical examination. It's more in younger children. Take note of that, which is a temporal loss of blood supply to the head of the femur, a vascular necrosis of the femoral head. So when that avascular necrosis of the femoral head happens, it's going to lead to bone death and reshaping. It usually affects children 4 to 10 years. So that was the summary of everything that I said. Okay. Then the next one is your sleep capital. So let me put this heading here so that in case if you want to take a picture, you don't mess it up. So this is a summary of the Legg-Calvé-Perthes. Then the next one is sleep capital femoral epiphysis. And I said that there is a dislocation of the epiphyseal end of the femur. It's usually found in children and more in adolescents. So what happened here is that it can be referred to as a fracture through the growth plate. Okay, through the growth plate. And I started breaking down. There are different types or the stages or the class where this fracture can happen. If it happens straight across, that will be type 1. And what part is affected? The part that is affected is the physis only. So you need to know these three things because in the exam, they can ask you what type of fracture and they can ask you what part is involved. So if it's straight across, that is type 1. And what is involved is only physis only. If it's type 2, is above, and what is affected is physis and metaphysis. If it's type 3, the fracture occurred low. You can see it lower here, then that will be at the physis and epiphysis. Then if the fracture occurs through everything, then that will be metaphysis plus physis plus epiphysis. Like somebody just remember my mnemonics. PM is like morning shift, PE is like evening shift, PEM is like working 16 hours, like evening shift and morning shift. Then crush is like working 24 hours. Just remember it that way. Okay, it helps you to remember. Then if it is crush, everything is broken. Okay, and it happens compression of the physis or it is crushed through. So let me know if you have any question. It's very important.